Assalamu alaikum. My name is Naula. I am the student of MS Chemistry, University of Management and Technology, Sialkot campus. Today, my topic of presentation is the brain. In this topic, I discuss about the various part of our brain, how it relate with other chemicals, how chemical imbalance occur, and what are their treatment. So first of all, brain structure and function. The brain structure is composed of three main parts. Number one is the forebrain, second one is the midbrain, and third one is the hindbrain. The further each part is composed of different part. We discuss for number one, forebrain. Forebrain is composed of the cerebrum, also known as a cerebral cortex. The cerebrum is the largest part of our brain, human brain, and is associated with the higher brain functions such as thought and actions. Nerve cells make up the gay surface, which is a little thicker and than our thumb. White nerve fiber beneath the surface carries signal between nerve cells. So it is a wrinkled surface increase the surface area and is a six-layer structure found in the mammal called neocortex. It is divided into four sections called lobes. There are the frontal lobes, the parietal lobes, and the occipital lobe, and last one is the temporal lobes. So these are the structures of one part of our brain. These are called forebrain, and forebrain are further divided into these are types. Number one is the cerebral cortex, the surface cerebrus, and limbic system. Limbic system is comprised of four parts. Number one is thalamus, hypothalamus, amygdala, and hippocampus. And now we discuss these are lobes. These lobes of forebrain. What are the function of these lobes? The number one is the frontal lobes. Frontal lobes lies just beneath our forehead and is associated with our brain's ability to reasons, organize, planes, speak, move, make facial expression, serial task, problem solve, control inhibitions, spontaneity, initiate, and self-regulate behaviors. Pay attention, remember, and control emotions. The second one is the parietal lobes. The parietal lobe is located at the upper rear of our brain and control our complex behavior, including sense such as vision, touch, body awareness, and spatial orientation. It plays an important role in integrating sensory information from uh, various part of our body, knowledge of member and their relation, and in the manipulating of objects. Portion are involved with our visual spatial processing, language comprehension, the ability to conduct and body positioning and movement. Neglect, intention, left right differentiation, and self-awareness insight. The third one is the occipital lobe, the occipital lobe is located at the back of our brain and is associated with our visual processing such as visual recognition, visual attention, spatial analysis, moving including 3D word, and visual perceptions of body language, such as postures, expressions, and gestures. Fourth one is the temporal lobe. The temporal lobe is located near our ears and is associated with the processing of our perceptions, recognitions of auditory stimuli. What are the auditory stimuli? Including our ability to focus on one sound among many, like listening to one voice among many at party. The second one is the function of our temporal lobe is the comprehension, spoken language, verbal memory, visual memory, and language productions. The other one is the general knowledge and autobiography memories. A deep furrow divides the cerebrum into two halves, known as the left and right hemispheres. And while the two hemispheres look almost symmetrical, each side seems to be functioned differently. The right hemisphere is considered our creative sides, and the left hemisphere is considered our logical sides. A bundle of axons called the corpus callosum connect two hemispheres. The fifth one, the midbrain is the second part of our brain, namely which we are discussed above. One is called forebrain, second one is midbrain, and third one is the hindbrain. And we are discussing about midbrain. What is the midbrain and what are their functions? Midbrain Midbrain is located below the cerebral cortex and above the hindbrain, placing it near the center of the brain. It is comprised of the tectums, tegmentums, cerebral aqueduct, cerebral peduncles, and several nuclei and faculi. The primary role of the midbrain is to act as a sort of relay station for our visual and auditory systems. Portion of the midbrain called the red nucleus and the substantia nigeria are involved in the control of our body movement and contain a large number of dopamine producing neurons. The degeneration of neurons in the substantia nigeria is associated with the Parkinson disease, which means that the Parkinson disease are related to midbrain. Midbrain is the smallest region of the brain and is located most nearly within the central cavity. Limbic system. The limbic system is often referred to as our emotional brains or childish brain. It is found buried within the cerebrum and contain the thalamus, hypothalamus, and amygdala and hippocampus. These are the structure of our midbrain, which are composed of thalamus, hypothalamus, telephons, cerebrums, pons, and medulla oblongata. These structures are basically discussing the defect or the different diseases given below. Number one, the thalamus, the primary role of the thalamus is to relay sensory information from other part of the brain to the cerebral cortex, which means that the thalamus part of our brain, the thalamus part of our brain is play a vital role in the sensory information from other part of the brain to cerebral cortex. It means that play a very important role in the sensory information. Hypothalamus, the primary role of the hypothalamus is to regulate various functions of the pituitary gland and endocrine activity, as well as a somatic function such as body temperature, sleep, appetite. Next one is the amygdala. The primary role of the amygdala is to be critical processor for the sense. Connected to the hippocampus, it play a role in emotionally laden memories and contain a huge number of opiate receptor sites that are implicated in the rages, fears, and sexual feelings. The other one is the hippocampus. The primary role of the hippocampus is primary forming, organizing, and storing information. It is particularly important in forming new memories and connecting emotions and sense, such as a smell and sound to memories. Pituitary gland are basically the pituitary gland is an important link between the nervous system and endocrine system. It releases many hormones which affect growth, metabolism, sexual development, and reproduction system. It is connected to the hypothalamus and is about the size of the pea. It is located near the center of skull, just behind the bridge of the nose. The last part of our brain is the hindbrain. The hindbrain is composed of the hindbrain, the cerebrum, or a little brain, is similar to the cerebrum with its two hemispheres and our highly folded surface. It is associated with the regulation and coordination of movement, postures, balance, and cardiac respiratory center. These are the structure of our hindbrain, which are composed of cerebrum, pons, medulla, spinal cord. The brainstem is located beneath the limbic system. It is responsible for vital life functions such as breathing, heart beating, and blood pressures. The brainstem is made up of midbrain, pons, and medulla. The second one is the pons. The primary role of pons is to serve as a bridge between various parts of our nervous system, including cerebellum and cerebrum. Many important nerves that originate in pons, such as trigeminal nerves, responsible for feeling in the face, as well as controlling the muscle that are responsible for biting, chewing, and swelling. It is almost contain the abundance nerves, which allows us to look for side to side, and the vestibular nerves, which allow to hear. As a part of the brainstem, a section of our lower pons stimulate and control the intensity of the breathing, while a section of upper pons decrease the depth and frequency of our breath. The pons is also associated with the control of sleep cycle and control respiration and reflexes. It is located above the medulla, below the midbrain, and just in front of the cerebellum. Medulla. The primary role of the medulla is regulating our involuntary life-sustaining functions such as breathing, swelling, and heart rate. As a part of the brainstem, it is also help transfer neural messages to and from the brain and spinal cord. It is located at the junction of the spinal cord and brain. Now, I am discussing about how brain structure change with life and with chemicals. Number one, we are discussing about how brain structure change. The brain structure of the brain is constantly changing from birth throughout the lifetime, meaning that normal aging free from dementia is associated with the structural brain change. This paper review in the incident that from that the imaging magnetic resonance imaging MRI is study about genes age-related changes in the brain. The main conclusion are that the brain shrink in volume and ventricular system expand in healthy aging. However, the pattern of changes is highly heterogeneous with the largest change seen in the frontal and temporal cortex and in the pituitary, thalamus and accumbens. With the modern approaches to analyze of MRI data, changes in cortical thickness and subcortical volume can be tracked over a period as short as 1 year, with annual reduction of between 0.5% and 1.0% in most brain areas. The volumetric brain, the second one changes is the volumetric brain reduction in healthy aging are likely only to minor extent related to neural loss. Rather, shrinkage of neurons, reduction of synaptic spines, and low number of synapses probably account of the reduction in gray matters. The third one is the reduction in specific cognitive abilities, for instance, processing speed, executive function, and episodic memory are seen in healthy aging, such as reduction are in the substantial degree mediated and by the neurotransmission changes. About 25% to 100% difference between young and old participants in selective cognitive function can be explained by group differences in structure brain characteristics. These are the structure of our brain who changes with the ages from 5 to 20 years. These are the basically our structure brain structure change with the ages, with the time of with the passage of time and with the ages. So the other one is what is the neuroplasticity? Neuroplasticity, where is neuroplasticity is used? Neuroplasticity is used in the brain. The brain changes itself through a process is called neuroplasticity. Let us dedicate this word. Neuroplasticity is combination of two words. Neuroplasticity is combination of two words. One is called neuro and second one is the plasticity. When we are talking about something related to brain, we use prefixes neuro. And the second term plasticity refer to fact that the brain is always transforming itself. When you meet someone or learn a new fact, your brain changes the structure and function. The environment can change our brains even if we are not aware of it. Before moving on to the example, we must consider two issues. First, neuroplasticity changes with the age. As we grow older, the brain continues to find different ways of dealing with things and situations. The ability to do this is related to the health of brain. Why our older people have always exercised and read a lot of engaging book, less formative ethics, because an active healthy brain can store mental resources that can be used when it's get older to modify itself. The second issue we must consider is that some neuroplastic event may not be helpful to use to us and may even be extremely harmful. This is what we call multiple plasticity. These are the graph when which relate the some brain changes and some behavioral changes in our early childhood preschool. Number one, the brain strengthen connection it used frequently and eliminate those that are not used. And the other function is some behavioral changes include the function of lifelong brain function, memory, and adaptability is established. The second one is the school age child. With the passage of time, part of the temporal lobes continue to grow and reach peak volume. And the behavioral changes include the ability to understand, process, and respond to a social situation increases. The adolescence neural network connection in the frontal lobes continue to grow and strengthen. And the behavioral changes include the ability to reason about abstract concept develop. Emotion are highlighted and intensity and arrogancy. Young adulthood areas of frontal lobes involved in goal directed behavioral matures, and the behavioral changes include impulse control and planning ability are mastered. The brain can better integrate information, for example, when problem solving. While the middle ages, existing white matter connections strengthen, allowing in the brain to efficiently engaging in more complex cognitive tasks, and the brain and the behavioral changes include abstract reasoning, mathematical and spatial reasoning, and verbal ability increase. Optimisms and social appropriateness increase. The older ages include some structure and region of the brain shrink, white matter decrease, and the behavioral changes include complex mental processor may be negatively affected. Vocabulary and experience-based knowledge remains strengthened. And now I am discussing about chemistry of knowledge. Chemistry of psychology. Chemistry of psychology. Chemistry of psychology include the psychology. We first are discussing about psychology and then discussing the chemistry of psychology and how chemistry is related to psychology or our senses. Psychology is the study of the human mind and how it functions, particularly in context of behavior psychology. In sometimes I have been interested in for several years, and I am planning to major in psychology in addition to a few other related topics such as sociology, criminology, and forensic science. So I can become criminal profiler and forensic scientist for the FBI behaviors analysis units. The psychology is involved in every aspect of life, even the smallest piece of what you do, even something as simple as smiling at someone in the hallway, the influenced by chemicals and neurotransmitters in the brain. Composition of two brain structure is called combined neurotransmission. There are over 100 naturally occurring neurotransmitters. Some of our most important would be, we know that our message transfer from one body part to another through neurotransmitter. Neurotransmitter are 100 of naturally occurring, and some are given below. I discussing about. Number one is the dopamine. These are the chemical formula included C8H11 and NO2. The serotonin, C10, H12, and 2O. Vasopressin, C46, H65, and 13, O12, and S2. Oxytocin, this is the most important in our brain. C43, H66, and 12, O12, S2. And acetylcholine, C7, H16, and NO2. Neuropendrins, C8, H11, and NO3. And the epinephrines, C9, H13, NO3, and the cortisol, C21, H32, and O5s. These are their structure of our neurotransmitter, and this is related to our brains. How it related our brain are discussing below. These are this basic structure of our neurotransmitter: serotonin, dopamine, norepinephrines, synaphrines, histamines, triamines, and acetylcholines. Now I am discussing the neurotransmitter which are discussing above, the main function and where it is found and how it relate to our brain function. Main chemicals components in number one, oxytocin. It is the most important neurotransmitter in our brain, and it is produced in the pituitary gland associated with love, trust, and attachment. The second one is the dopamine. It is produced in the hypothalamus. The hypothalamus is the part of our brain, part of our hindbrain, and affect voluntary movement, learning, memory, emotions, and response to environmental factors. The third one is the serotonin, C8, C10, S12, and 2O. This is also very important and produced in a multiple area of our brain. And this function is to help with sleep, appetite, perceptions, body temperatures, pain expressions, and moods. The other one is the vasopressin, C46, S65, and 13, O12, S2, produced by the peripheral nervous system. It is produced in our peripheral nervous system, involved in attachment and development, trust and emotion, like love. And the other one is the acetylcholine. It is basically produced in the central brain It means that it produces in the midbrain, and it affects the needed for cognitive functions, muscle movement, memory, and motions. Adrenaline group, adrenaline, these are the main group, and are further divided into three neurotransmitters. Number one, the epinephrines, neuropinephrines, and cortisols. And it is and these neurotransmitters are produced in hypothalamus and pituitary gland, and these are affected and influence fight or flight, fear, and aggressions. The other, now I am discussing how chemistry is role in our brain and how it affect our brain with the different diseases and with their concentration, high concentration or low concentration. Chemistry role. Chemistry role, too much or too little of any neurotransmitter cause the chemical reaction in the brain to be unbalanced, resulting in various mental conditions such as OCD, depressions, Alzheimer, schizophrenia, dementia, and others, which are discussing below. Number one example. These are example including the how chemical relate with our brain with a high and low dosage. Number one, not too much adrenaline causes anxiety, OCD, PTSD, and other paranoia, fears-related disorder. The OCD, including fear-related diseases. The second one is the too little dopamine and oxytocin can also be related to anxiety as well as depressions. The other is those who suffer from Alzheimer have a lack of acetylcholines. Anyone who has trouble with addictions can have any range of chemical imbalance thing, as well as coffee or caffeine change the chemical balance of the brain. Chemical overload can cause seizures and epilepsy. There is other factor involved in these chemical reactions, as aforementioned above. Addiction can greatly affect the chemical balance in the brains. However, the brain chemistry, now I am discussing about the brain chemistry, neurochemistry. Where we use brain, we use the word neuro. Neuro means brain. The brain communicates with itself by sending out chemical information from one neuron's nerve cell to another. Brain chemistry is the sum of all the chemical messages that take place in the brain, which allow it to carry out its daily functions, such as generating movement, speaking, thinking, listening, regulating the system of the body, and countless other. Neurotransmitter is the brain chemicals that let brain cell communicate with each other and therefore the brain to function properly. In other words, neurotransmitter transmit carriers as a chemical message from neurons to neurons. These were the figures show that our spinal cord, and this is the tissue injury, and histamine is the main chemical which are used to breaking the 5-type postgraduate ATP, OCD, CCRG, and substance. It means that histamine, these are the chemicals that play a very role in this horse rush of happiness. The other one is any one neurons may be receiving many chemical messages, both positive and negative. Positive and negative neurons we also called stop and go from the other neurons and surrounding it. These neurotransmitters may be competing to get the neurons to respond to different ways, or other may work together to produce a certain effect. Since all this happens with a split second, neurotransmitter must be cleared away quickly so that the same receptor can be activated again and again. The food affected brain's chemistry and function. Many such effects involve the blood-brain barriers, BBB, which facilitate the brain transport of some water-soluble molecules such as glucose, many amino acids, exclude other molecules, and permit diffusion of lipid-soluble molecule. Glucose is the principal energy substrate of the brain. Ketones bodies are used during starvations. Amino acids are incorporated into proteins and function important small molecules. The neurotransmitter fatty acids are converted into membrane lipid. Two essential fatty acids have other important function. Vitamins and minerals enter brain via BBB, which means that blood-brain barriers. Diet affects the brain uptake of many of these nutrients, which often influence brain function. Now I am discussing brain chemical disorder, chemical imbalance and brain disorder, which are same. Chemical imbalance occur when the substance that help the body function the way it should become out of balance. Either too much or too little of these substance can cause a chemical imbalance that affect the body's ability to function normally. These chemical imbalance are often linked to health condition. For example, hormonal imbalance occur with the polycystic ovary syndrome, which in turn put a person at a risk of other conditions such as type 2 diabetes and infertility. Which too much or too little of these substances anywhere in the body is considered a chemical imbalance. In terms of chemical imbalance is usually associated with the chemical imbalance in the brain and their potential effect on the mental health and related condition. Chemical imbalance in the brain that help facilitate communication between nerve cell are called neurotransmission. It means that when the chemical transfer from one body part to another, these function, these phenomena is called neurotransmission. And when these transfer are when these messages transfer through cell is called neurotransmitters. These are the different chemical imbalance or mental disorder in which affect our brain and how it affect our brain and what are their causes. Number one, acetylcholine. These are the neurotransmitter and too much produced in our temporal lobe, which cause the depression, and too little of these production is called the dominatium. The second was is the dopamine. Dopamine is also neurotransmitter or chemical which produce in our frontal lobes. Too much cause a schizophrenia, and too little some form of depression, muscular rigidity, and tumors found in the Parkinson's disease. It means that dopamine chemical is main causes of Parkinson's disease, which affect our frontal lobe of our forebrain. The third one is the serotonin. Too little of this cause depression and some anxiety disorder, especially obsessive compulsive disorder, which affect our forebrains. Forebrain and forebrain is further affected our frontal lobes. The fourth one is the gamma aminobutyric acid, which too little affect the parietal lobe anxiety disorder. Some anxiety medication increase GABA at receptor site. GABA include gamma aminobutyric acid. Norepinephrines too much cause a schizophrenia, which affect our temporal lobes of our forebrain. And other one is the adrenalines. Too much it cause the anxiety and anxiety disorder. Epinephrines too little cause the depression. It means that many of these chemicals cause the depression and anxiety with the dosage of little, too little, or too much. Some of the brain neurotransmitter include serotonin, dopamine, neurofilins, acetylcholine, GABA, gamma aminobutyric acid, which I discussed above. And these are neurotransmitter function, and these are neurotransmitter function including the sleep, appetite, mood, arousals, behavior, cognitions, pleasure, early brain development, memory, learning, stress, response, flight or fight. Disinfection of these neurotransmitter has been linked to a condition such as schizophrenia, anxiety disorder, depression, bipolar disorder, Parkinson's disorder. It means that Parkinson's disease, why there is a question of why Parkinson's disease occur. Parkinson, it means that Parkinson's disease occur when the dopamine neurotransmitter produced too little in the our brain of the forebrain. And just like that, an anxiety disorder occur when the neuropinephrine acetylcholine GABA is produced too little. The balance of chemical in the brain is thought to be a one influence of one on depression and anxiety disorder, along with the combination of factors such as faulty mood regulation by the brain, genetics, environmental factor like stressful life event, medication problem. And now I discussing there is a question, can stress cause a chemical imbalance? In addition to affecting the balance of neurotransmitter, stress can affect chemical balance in multiple systems of the body, including the nervous system, the digestive system, the endocrine hormonal system, and the cardiovascular system, and the last one is the reproductive system. Depression, why depression is occurs? The idea that depression is caused by serotonin deficiency was popular in advertisement as antidepressant medication in the early 2000, and many mental health professionals reflected they explained this patient. The chemical imbalance and serotonin deficiency were used as a metaphor for the more complex working in the brain and factors involved with the depression. This originally led many people to believe that treating depression with antidepressant was like treating hypothyroidism with thyroid medication, or type 1 diabetes with insulin, or simple matter of replacing low serotonin. The other one is the chemical imbalance in the brain. The symptom of chemical imbalance in the brain are associated with several psychiatric diagnoses. Form of depression, why depression occurs. There are several forms of depression, each with its own unique list of symptoms. For a more complete list, it is best to research depressions by type. Some of more general symptoms of depression include persistent sad, nauseous or empty mood. Second one is the feeling hopeless, negative, pessimistic, and the third one is the irritability, and fourth one is the feeling of guilt, worthlessness, or helplessness. Fifth one is the loss of interest or pleasure in hobbies and activities. The sixth one is the decrease in energy. Seventh one is fatigue. Eighth one is the trouble concentration, remembering and making decision. 9 one is the sleep difficulties. 10 is the change in weight or appetite, thought of death or suicide attempts, unexplained physical symptom like ache, pain, headache, and digestive problem. It means that depression causes these symptoms when these occur. In anxiety disorder, with depression, there are several types of anxiety disorder which are best explored individually. Some general symptoms of anxiety disorder include feeling panic, fear, and uneasiness, uncomfortable, obsessive thought, repeated thought or flashback or traumatic experience, sleep difficulty, difficult sitting still, nightmares, unexplained physical symptoms such as cold or sweaty hands, dry mouth, muscle tension, or unbalanced triangle in handout or field, heart rapidness, nausea, shortness of breath. These are the general symptom of our general anxiety disorder, GAD. Schizophrenia. Schizophrenia has been working strongly linked to a chemical imbalance in the brain. Symptoms of schizophrenia include delusions, hallucinations, disorganized speech and behaviors, lack of emotions, paranoia, withdrawal from others. Cause of this chemical balance in the brain is sometimes something that may cause neurotransmitter of the functioning properly include receptors may become sensitive or insensitivity to a specific neurotransmitters, causing them to respond too much or too little to the release of the neurotransmitter. If the original cell pump out too little of neurotransmitter, the message may be awakened. The overall efficient uptake that reabsorb too much before the molecule have the chance to bind to the receptor or other neurons can also weaken messages. It is important to note that these factors apply to neurotransmitter disruption and do not necessarily cause a mental health condition in form of themselves. It is also a hypothesis that the mitochondria may play a part of the brain function neurotransmitter in the role of the diagnosis. Unlike some other chemicals in the body, neurotransmitter cannot be accurately measured. It is not possible to determine that a person has a chemical imbalance in the brain. The theory of chemical imbalance and its effect on mental health largely stem from the success in symptom reduction from the medication when used to treat mental health condition. But this link is far from clear-cut. Instead of making a diagnosis of chemical imbalance in the brain, diagnosis of specific mental health condition are made. Now I am discussing what are the treatment of these above diseases. Number one, medication. Antidepressant and other medication that affect brain chemistry are often prescribed to treat the condition associated with the chemical imbalance. While these medications do help some people, they are not a cure-all. The mental health disorder have multifaceted causes. While two people may share similar symptoms, they may have a different pathologies and respond differently to treat options. Some medication prescribed in influence neurotransmitter function include selective serotonin reuptake inhibitors, These inhibitors work by inhibiting the uptake of serotonin. Example include Calex, Lexapro, Lovex, Paxils, Prozac, Vibrates, Zolphides, serotonin, and uptake inhibitors. It means that every body have a different pathological condition, and everyone have different selective inhibitor serotonin inhibitor receptors. It means that these are the medication which are treated above the serotonins. The other is the TCA block. The TCA means tricyclic anti-deep resistant block the absorption of serotonin and neuropinephrine, as well as having several other impact neurotransmitter. Example include the other one is the anaphrenols, ascendants, exules, neuropamines, pamulars, synchronisins, sormentals, and trophinols. These are the basically absorption of serotonin and neuropinephrines. While the above mentioned medications are the selective serotonin inhibitors. It means that one is the absorption and one is the selective monocytes. The other one is the monoamines oxide inhibitors. Monoamines oxide inhibitors is the action of an enzyme called monoamine oxide, making more neurotransmitter available for use in mood regulation. This one include epsom. This one is included epsom, marplins, nardils, and atyl antipyricils antibody resistance. These are the new antibody resistant, do not fit into the above category. Example include trazodons, vertigoxins, serotonin antagonist, and uptake inhibitors. The second one is the valbuterins, dopamines, and neurophenins uptake inhibitors. Antipsychotics are used to manage psychosis or loss of contact with reality. Example of first generation typical antipsychotic medication include chlorpromazines, haloperidols, and paraphenazines. Non-pharmaceutical treatment for psychotherapy treatments such as cognitive behavior therapy (CBT) can be effectively for many mental health conditions. These therapies may affect the function of neurotransmitter by changing neural pathway and associations. The second one is a bipolar disorder. Bipolar disorder is a mental health condition that affects our mood, which can swing from one extreme to another. It is used to known as manic depressions. Symptoms of bipolar disorder include people with bipolar disorder have an episode of depressions, mania including feeling very high and overactive. Symptoms of bipolar disorder depend on which mood are experiencing. Unlike simple mood swings, each extreme episode of bipolar disorder can last for several weeks. These are the bipolar disorder and which affect our mania, depressions, and anxiety. The cause of these include the extreme stress, overwhelming problem, life-changing events, genetics, and chemical factors, chemical imbalance in the brain. Bipolar disorder is widely believed that to be result of chemical imbalance in the brain. Chemicals. The chemical used in the brain, bipolar disorder are the chemical responsible for controlling the brain function are called neurotransmission transmitters and include noradrenaline, serotonin, dopamine. These are some evidence that if there is imbalance in the level of one or more neurotransmitter, a person may develop some symptom of bipolar disorder. For example, there are evidence that episode of mania may occur when the level of noradrenaline are too high. An episode of depression may be the result of noradrenaline level become too low. Genetics. It is also thought bipolar disorder is linked to genetics as it seems to run in families. The family member of a person with bipolar disorder have an increased risk of developing it themselves, but no other single gene is responsible for Bipolar instead, the member of genetics and environmental factor are thought to act as a triggers. The other one is the mania. Mania included during manic phase of bipolar disorder. You may feel very happy, have a lot of energy, ambitious plan and ideas. And the other is the chemistry of Alzheimer's disease. This is the most important discussing our topic. The chemistry of Alzheimer's disease is largely centered on the amyloid beta peptide in its formation, structure and interaction with the metals, membrane, protein and other species. The healthy human brain contains 10 of million of neurons, specialized cell that process and transmit information via electrical and chemical signals. They send message between different part of the brain and form the brain of the two muscle and organ of the body. Alzheimer's disease disturb this communication among the neurons, resulting in loss of function and cell death. It means that these are the amyloid beta which affect our brain to destroy this communication and cause the cell death. It means that these are the structure of our amyloid beta. First one is the covalent conduct formation, and second one is the transformation of amine group from one, and other is the ring is destroyed, and it means that cell death occurs. Amyloid plaque, the beta amyloid protein involved in Alzheimer's, comes in several different molecules from the that collect between neurons. It is formed from the breakdown of a large protein called amyloid precursor protein. One from beta amyloid 42 is thought to be especially toxic in the Alzheimer's brain. Abnormal level of this neutrality occurring protein clamp together to form a plaque that collect between neurons and disrupt cell function. Research is going to better understood how the at which the stage of disease, the various form of beta amyloid influence Alzheimer's disease. Now we have discussing how the brain damage recovery occur. It is very from ages to ages. A person chance of recovery after TBI heavily depend on the severity of the injury. Generally, the more severe the brain damage is, the lower an individual chance of making a function recovery rate. This is not always the case, but is a general outlook. These are the basic. It is a separate study data follow patient with a several TBI for 4 years. 28% achieve a full recovery, and 79% were living independently with other only minimum resistance. Other sources show slightly better load. According to statistics gathered from the TBI model system program regarding individual with a moderate to severe brain damage at 2-year post-injury, the 30% of the patient need at least some assistance from another person, and 70% live alone full time. Over 90% live in private residence. 50% of the patient learn how to drive after brain injury, though there are maybe still by restriction on driving at night or for long distance. 30% have a job, though it's usually different from what they had before their injury. So my topic of presentation is completed.